Right, Kate Allison. My husband is suffering with long COVID. Has been off work since October. Only gets SSP. Not entitled to any financial help at all. And we're struggling. Is this something that could be looked into, please? Yes, Kate. I think I'm not sure whether it was you flagged something similar. No, no sound now. Shall I keep going? I'll keep going. Yes, I think I covered something similar to this earlier. We will pick this one up with government and see whether there's anything that can be looked into. Um, Jane Elizabeth Murray, vaccination centres in Cumbria. Surely there should be one in Cumbria. Yes, Jane, Morecambe's not the nearest one, but the ones in Ulverston and Kendal have been getting very booked up. So there are definitely going to be new ones established in North Cumbria. As I said earlier on, there's centres in Carlisle and Whitehaven in community pharmacies. They're opening with any luck on Monday. Lee, as I say, why is there not a reply slip attached to the COVID jab letter for people who don't want it? As the COVID centres won't know they aren't coming until the exact time. This has caused waste in vaccines. Well, Lee, it shouldn't be causing wasted vaccines, but you make a fair point that one of the things that we don't know is how many people have been offered it and actively don't want it. We know that people have been offered it and not turned up, but we don't know whether that's because they don't want it or because it wasn't a good time for them or because they don't have transport. So that might be something that it's worth looking at. We can, again, I can pick this up with the national team who runs this. Rebecca Thomason Page, have you back? Okay, here's my previous question. On the steward volunteer waiting list for NHS Royal Voluntary Service as well as North Cumbria Integrated Care, when do we expect mass vaccination site to open in Penrith? Is this likely where I'll be called up to help? Rebecca, we are currently thinking that the mass vaccination centre in Penrith is likely to be towards the end of this month. It could open sooner than that if there was enough vaccine coming into the country and the county to justify opening the vaccination centre earlier than that. But at the moment, all vaccines are going to primary care in the north of Cumbria, and they are making full use of that. But we are fully expecting a near doubling of the vaccines coming into the county in the next week or two. And at that point, it will make sense to open the vaccination centre in Penrith. Oh, okay, yes, you can hear me. And I don't see very many people saying that it's freezing now, so that's better. Right, Sammy Lure, what group does asthma come into? Sammy, that's actually a more complicated question than you would think. Unfortunately, people who have got severe asthma come into group 6, so people who've got conditions that make them more vulnerable to COVID-19, and that's being vaccinated now. But people who've got not so severe asthma will be vaccinated with the rest of the general population because they're not considered to be so clinically vulnerable. Now, of course, the challenge there is that throws up all sorts of questions around what counts as severe asthma and what counts as less severe asthma, and that becomes a clinical judgment as much as anything else. So I'm afraid it's not a straightforward answer. Katie Johnson, can we clarify tests in primary schools and parents? So Katie, the commitment is that primary school children and parents should be able to test twice weekly at home from next week. That the ways in which you can access those tests are being communicated through schools at the moment. So schools will be able to tell you where you can get those. There will be some that might be going out via schools and others where you'll be asked to go to a community collect site, which might be one of the testing centres that we have across the county. So information on this is coming out in the next couple of days if it hasn't already. Lucy, Amy Irwin, are we not worried about opening the pubs, clubs, hotels and seeing another lockdown because of that mass influx of tourists? Yes, Amy, frankly. Yes, I'm worried about opening pubs, clubs and hotels. Those are the areas that we know there's a high risk of transmission. But the intention at the moment is that they will be opened much later in the year, into June when things open later in the year, by which stage many more people will have been vaccinated and the rates should have come significantly down. So it's something that we will be keeping an eye on, and government will be keeping an eye on to see whether it's felt to be safe to open those again at that point. And if the rates are still too high, then they'll stay closed. But that's a national decision, not one for us at a local level. Um, Angie Strong, when are over 65s getting their vaccine jab? Angie, all over 65s are currently eligible for their vaccine jab. Most over 70s have had it. And we're making good progress into the over 65s. So if that's something if that's about you or a parent or a relative or something, if they haven't had their invite yet, they will be getting it very, very soon. Sharon Stamper, County Council NHS doing an amazing job. Well done to you all. Thank you very much, Sharon. I appreciate that. Certainly when it comes to the vaccination, which is the major thing at the moment, I can't claim very much credit for it. I have to say it is almost entirely an NHS responsibility, and they are absolutely doing an incredible job. I never thought that we'd see this number of vaccinations carried out in such a short space of time. Kelly Walker, lateral flow tests, how accurate are they? Told by a relative who works at a testing site in Birmingham that they're only 40 to 50% accurate. Very good point, Kelly. Lateral flow tests have what you're looking at there is the sensitivity. How likely are they to pick up a positive case? In clinical settings, they appear to be around about 80% sensitive. I have to say that does drop with people who are less experienced in doing swabbing. So it's entirely possible that with the general public, the expectation is that they're about 60% sensitive. So they will still miss cases. But when we're starting to use them in the way that we're using them at the moment, so testing people who wouldn't have been tested at all otherwise, then it's still a very good thing, even if if people are doing things that they would have done anyway and are being tested. If you can identify 60% of the cases, then that's much better. The worry comes when you use things like that to allow people to do things that they wouldn't have done otherwise. And then if you're missing cases, it can be much more serious. So they're not bad, and they particularly pick up people who've got a high viral load, so are most likely to be infectious. So even if they're only 60% correct, they'll pick up the majority of the most infectious cases. Jacqueline Cashman, there'll be a centre in Carlisle to Pharmacy Hub. Can you change your appointment from Morecambe to Carlisle for your second appointment? I think I don't actually know the answer to that, Jacqueline. I think you would have to speak to the people in Morecambe and see whether you could make a second change your appointment there. I don't see why it shouldn't be possible, but you would have to speak to somebody to confirm that. Julie Clayton, thanks for persevering. Could we explain why people need to keep following the guidelines once they've had the vaccine? Well, two reasons, Julie. Thanks for the question. The vaccine has some challenges, of course. It's not 100% successful. It's very, very successful, but even if it's 95% successful, that means that out of every 20 people, one person won't be protected by it. So it's important that people still follow that for the moment because of that. Also, it is possible for people still to pick the virus up and transmit it to others when they've been vaccinated. So it's important for them to follow the rules for that reason as well. But it's also important because in order to make sure that we can control this virus as best we can, it's really important that we don't let the virus evolve into something that resists the vaccine. And if in a situation where you are vaccinating a lot of people, you're actually putting pressure on the virus to evolve. And if you let it get transmitted through the population, while there is a pressure for it to evolve and it's exposed to people who have had a vaccine and are not necessarily immune to it, that's exactly the situation in which a virus immune to the vaccine can take hold. So it's very important that as we roll this out, we keep on doing whatever we can to minimize the transmission of the virus through the community. Elizabeth Reeve, you can't wait to have an experimental jab made in 10 months that slipped the animal trials. Well, Elizabeth, I can't wait to have that jab. I haven't had my jab yet because I'm not in one of the priority groups. It's not an experimental jab. It didn't miss any of the stages. Neither of the vaccines that we've got missed any of the stages. They've been done very quickly. That's absolutely right. But that's because of a lot of work that has been done on different styles of vaccine beforehand. And so we weren't starting from a completely blank slate. And also, governments across the world, billions and billions of pounds at this. A lot of, when you're doing most vaccine research, half the time that you spend on this is waiting for grant approval to come through, and recruiting enough people to do your study. We didn't have to wait for people to be recruited to the study because there were hundreds of thousands of people across the world who were getting COVID. It was very easy to recruit people to the studies. There was no problem with money. There was no problem with the number of researchers because everybody turned their attention to it. It was a remarkable achievement to get these vaccines done in 10 months. So I personally, when it comes to my turn, I will have absolutely no hesitation in taking either of the vaccines that we've got at the moment, or indeed if the Moderna vaccine is circulating at the time that I get mine, I will not have any problem with taking that vaccine either. Um, Chris Murphy, I have spina bifida and hydrocephalus. Is cohort 6 correct for a chronic neurological condition? Oh, Chris, I would actually have to check that. But the JCVI, the Joint Committee on Vaccination and Immunisation, it has got a clear list of who falls into cohort 6. So if you simply Google Joint Committee on Vaccination and Immunisation, you'll find that information very, very quickly. And I think that I would advise you to do that rather than me taking a guess at that. Fiona Mullen says all asthma should be category 6. Well, maybe it should, Fiona. That would certainly make life easier in terms of who gets the vaccine and who doesn't. But that's not the decision that has been taken by the Joint Committee on Vaccination and Immunisation. It's not something that we have any control over at a local level at all. Laura Robson Parrott, you hear that there are spare vaccines being given away when people show up at the end of the day. Could these be offered to specific job sectors such as transport or education who are coming into contact with lots of members of the public daily? Well, Laura, there was a time when that was happening quite a bit, particularly in the early days with the Pfizer vaccine, when we were getting bunches of 975 of them. And once you'd opened that, you had to use it all within 5 days. And so quite often then there were spare vaccines and they were just being given to whoever we were able to get access to. The situation has significantly improved, I hope. I know that there are still some people who are slipping through and getting vaccinated when they shouldn't. But we now have got vaccines that are much better controlled, much more flexible and able to be used without so much potential wastage. So I hope that that's not happening nearly as much as it was in the early days of the vaccine program. Where there is a list of people who are kind of on a backup list, it ought to be coming from the next cohort down, rather than people in specific sectors. Jackie Moffat, as a 50-year-old key worker, when you due to get the jab, key workers don't have any specific time to get the jab. Only health and social care, frontline health and social care workers were identified as getting the jab specifically, and that's not to protect them particularly. It's because they come into so much contact with vulnerable groups, and that's why they were getting the jab, to protect the vulnerable people that they're working for. So unless you're working with, so unless you're in one of those social care and health groups, as a key worker, you will get your jab at whatever age cohort it rolls out. So 50-year-olds are coming up faster than you think. I think we're on the 60 to 65-year-old age group now. It won't be all that long before 50-year-olds start to get off with this. The commitment by government is that everybody in groups 1 to 9, which would include 50-year-olds, should be done by the middle of April. So I said when they committed to doing groups 1 to 4 by the middle of February, I said I was very skeptical about whether that would be achieved, and it was achieved. So I'm not going to make that mistake again. I think the way that this is rolling out, we ought to be able to get everybody in groups 1 to 9 done by the middle of April. Nick's Macca, are we not worried about the Appleby Horse Fair? Yes, Nick's, we're worried about the Appleby Horse Fair. And the group that is involved in planning for that is making recommendations that it does not go ahead. It would not be appropriate for it to go ahead this year. Now, obviously, the Appleby Horse Fair is not something that we control directly, so we can talk to the people who are most influential within the travelling community and try to persuade them to call it off or postpone it for later on in the year. And those conversations are underway. It does feel like it's too early for the horse fair to be back in the sort of scale that it often is. Anne Ross, a new self-cleaning coating that lasts up to a year that will go on door handles, etc. How do we get this approved by the council? Genuine question. And genuinely, Anne, I don't know is the answer to that. The council just purchases things as it requires it. I think you would have to get in touch with the procurement departments within the council to understand that. But we would always be looking to be buying products as they were needed, and ones that had any forms of regulatory approval. So I think it's much more about provision of the evidence that it works, and we would be purchasing things if we felt that we needed those. Jennifer Rowland, schools don't know what's happening about test kits for students or families yet. Hopefully guidance will arrive soon. Yes, Jennifer, I hope it will. I have to say the rollout of LFT, lateral flow tests for schools, is being done nationally, not locally. So it's not something we're directly in control of here. But I will follow up whether the guidance has come through yet. And if it hasn't, we'll get something out as quickly as we can to try to support schools. Right. Some comments. Andrew Thoburn, when can you travel to Scotland to see family? Well, Andrew, that's of course dependent on two things. The first is the releasing of the England stay-at-home guidelines, where we're expecting those to be released early April, late March or early April. But then, of course, it also relies on when Scotland releases its guidelines as well. And Scotland is being a bit more cautious in its approach, even than the English relaxation. So I don't think you can look to that anytime until before April. And do follow through and look up the Scottish guidelines as well, if that's what you would like to do. Pauline Scott, Cumberland shows cancelled, Kendal calling going ahead, and maybe Appleby Horse Fair. Are we happy with this? Well, Appleby Horse Fair, as I've covered just now, we're hoping that we can persuade the people involved in that to postpone that for later on in the year. Kendal calling is saying that it's going to go ahead. It's taken, I think, a little bit of a risk. The government has talked about when it wants to open everything up, but the dates that the government has given are the earliest possible dates at which these things will happen. So Kendal calling, I think, is going to have to be kind of careful about that. Put it this way, if Kendal calling is on, I won't be going to it, even if it is going. Certainly, my sense is that it's a bit early for some of these things to open up, but if they're allowed to nationally, and if people want to take those risks, I guess that's up to them. My own view is that it would be better to keep things smaller for the time being. Alexander Sharp, has the rate of infections in local factories dropped in the area? So working one, I've had a number of cases. Yeah, Alexandra, we are of course still seeing a number of outbreaks happening, but they're much lower now than they were. So yes, the rate of infections and the rate of outbreaks in local factories and other workplaces has dropped. But clearly we need to stay vigilant on that, and we're working closely with a lot of workplaces to make sure that they are as COVID secure as possible. Ray Forster, people who have had double pneumonia, are they eligible for the COVID jab? If it's something they've had in the past, Ray, but it's not turned into a chronic long-term condition, I suspect not, but if it's a chronic, recurring lung and respiratory condition, then they would be in at the very least group 6. But again, that's something that you would have to check with your GP and to see whether they get the clinical judgment on some of that. Fiona Millen, what about disabled 16-year-olds under the 18-year-old vaccination scheme? Shouldn't all disabled people have the vaccination? Um, Not necessarily, Fiona, because not all disabled people are particularly vulnerable to COVID-19. It depends on the nature of that disability. And that's been one of the challenges in identifying who needs to be in group 6. It's identifying the clinical nature of that vulnerability. You can put some definite headlines on it, but ultimately it's going to come down to clinical judgment a lot of the time as to whether somebody is particularly vulnerable to COVID-19. Right, Michelle Masters, government's thinking of bringing in passports for vaccines, but what will happen to people who have immune conditions and can't have the vaccine? A very, very good question, Michelle. I would expect that if any sort of vaccine passport comes in, if people are genuinely unable to have it for conditions like immune conditions, then they would be able to have that recognised on a vaccine passport to say that they weren't able to have it. But that is one of the reasons that it's so important for everybody who can have it to have it, because only by achieving that herd immunity, by having so many people who've been vaccinated that it reduces the transmission, that's what protects the people who cannot have it, like people who have significant immune conditions. Okay. Let's see. Deb Lewis, are all areas in Cumbria on target for vaccines? In terms of administering the vaccine, Deb, the vast majority of places are. There are one or two that have still got a little bit of catching up to do, but Cumbria is slightly ahead of the game nationally. The limiting factor for us is, as I've said, the supply of vaccines that's coming into the county. And at the moment, the last couple of weeks, that's been low. But it's been low nationally. That's not Cumbria particularly losing out. It's about the supply of vaccine, the manufacture of vaccines, and the amount that there is in the world, and how much of it comes into the UK. We are fully expecting a near doubling of vaccinations to start flowing through the county in the next couple of weeks. James Blizzard, is it true that the vaccine contains the intellectual property of the manufacturer? Does this mean you are part owned by that company? No, it doesn't mean that at all. The vaccine may be the intellectual property of the manufacturer. That just means you can't copy it. It doesn't mean you're part owned by that company. Can we put proof up in here of where it was trial on animals? In that case, not up here, I can't, Elizabeth, but you can be assured that the vaccines did not skip through any of their safety or efficacy stages. Tracy Todd, should they not only let Cumbrians book into Cumbrian hospitality to stop people from out of the area coming in? Well, once we get to the point where the hospitality sector is reopened, then that's not going to be an issue, because people will be allowed to come in to Cumbria. Our concern is much more that while self-catering accommodation is due to open up not that long after the stay-at-home guidelines go, campsites are supposed to stay shut for a bit longer than that because they've got shared facilities. And we think that's probably not going to be helpful for us in Cumbria, and we're trying to persuade the government to change that rule. Debbie McKenna, hi Debbie, is the uptake of testing for those who can't work from home good? Yeah, Debbie, it's interesting. We've got a number of centres doing lateral flow testing available now for all those who cannot work from home. It's been a relatively slow start to that process, I have to say. I think when it's being done in people's workplace, the uptake is very, very good. Where we're asking people to go to a local centre, usually a school in these cases, in the evening or at a weekend to get a test, the numbers have been fairly low, but it's early days in that at the moment, and I hope that they will pick up. Hazel Dobson, home lateral flow tests are and have been of use at picking up positive cases. Maybe they're not brilliant, but nevertheless a very useful tool. Yes, absolutely. That's what I was going to say. I said that a bit earlier on. More positive stuff from some people here. Ashton Tyres, when will it be safe to attend venues like football matches where it's easy for social distancing? And with it being outside, it's harder to catch the virus. Ashton, to be honest, I actually can't remember when mass events, outdoor events like that, are due to open up. I think it may be sometime in May, but I wouldn't swear to it, so don't quote me on that. But that is definitely written into the national lockdown easing plan. So you should be able to find that information on the national and the government website. Bryony RD, why aren't nursery staff closer to the top of the vaccination list when they've been looking after our children all the way through this lockdown? Thanks. Bryony, as I've said in the past, the vaccination list is entirely based on who is most at risk of serious harm and death, in particular death from catching COVID-19. And there's absolutely no evidence that that nursery staff are at any greater risk because of the job that they do. So it genuinely is as simple. The people who've been vaccinated are those who are most at risk of dying, or in the case of health and social care staff, the people who are at most risk of transmitting the virus to somebody who is themselves very, very vulnerable. Janine Slater-Lowe, why can't you get your vaccine in Carlisle rather than having to travel to Kendal? Carlisle doesn't have any vaccine centres at the moment, Janine, but there will be one opening in a community pharmacy in Carlisle on Monday. Apparently that's not available on the website at the moment. We don't quite know why. It should be. It's being followed up. That's not just a Cumbrian problem. Apparently quite a few of the community pharmacies are not showing up on the website at the moment. But the pharmacy in Carlisle will be available as of Monday, we hope. Leslie Clements, secondary age children getting weekly testing, will their parents be as well? Yeah, yes, Leslie, that's the intention. The government's rolling out testing for parents as well as children. For the first couple of weeks where children are getting tested in schools, but after that, when testing is done at home, then parents can do it as well. Lowther Nicholson, as a nurse, got first vax within a week, got COVID, and left with considerable breathlessness. Previously fit, only 49. What are the risks of second vax bit? Worried it's going to make her ill. Well, Katrina, that's such a shame, and I'm really, really sorry to hear that. The vaccine itself will not have given you COVID. It can't. The challenge with the vaccine is that you get vaccinated on day one. You're not immune on day two. It takes time for the vaccine to build up immunity. Indeed, it can take up to 3 weeks for the vaccine to build immunity. So it's not impossible to get vaccinated one day and then catch COVID a couple of days later. So it's just really unfortunate if that's what's happened to you. So the risks of the second vaccine are not there. It shouldn't make you ill. It won't get. It certainly shouldn't give you. It can't give you COVID. Ronnie Wood, are the vaccines being registered on your passport? No, Ronnie, they're not. Certainly not at the moment. But internationally, I know that there are conversations going on, and I wouldn't be at all surprised if internationally some sort of vaccine passport was required. In the same way as at the moment for travel to some parts of the world, you need a yellow fever certificate to show that you've been vaccinated against yellow fever. And I think many countries will introduce something like that over the coming months. Marie Irwin, are foster carers classed as social care workers? Now, again, Marie, this is one of the controversies around at the moment. No, they're not classed as social care workers because most foster care carers, well, they're doing a social care role. They're not necessarily doing it with children who are particularly clinically vulnerable to COVID-19. So no, they're generally not classed as care workers. I know that in some places that they've decided to vaccinate foster carers. That's not part of the JVCI cohorts, however. Ruth Rhodes, primary school children not being laterally flow tested, the household testing for those with children in primary or secondary school, is this just for parents who need tests for our primary age children? Yes, Ruth, in secondaries, children, in the first 2 weeks that children go back to secondaries, they're being tested in school, and after that it's moving to home testing. Primaries, it's going to be home testing throughout. So yes, the expectation is that tests will be available for primary age children. Pauline Dickinson, why is it 60 to 65 age group at North Medical Centre in Carlisle are doing under 60 and some 40-year-olds with no underlying health conditions, when some over 60 are asked to do 100 miles round trip to get one? Pauline, all I can say to you is if there are medical centres systematically doing under 60s and offering it to 40-year-olds with no medical conditions and who aren't health and social care workers, for example, then they shouldn't be, because that's not within the JVCI cohorts. We are strongly trying to get people to follow the JVCI cohorts, because that's the fairest way of doing it, and it's the way in which we minimise the harm from COVID-19. It should be people who are 60 and over are now starting to be offered the vaccine via the national centres. That will mean travel if you're in that group, because there isn't one in Carlisle at the moment, though it is coming. But it is intensely frustrating to when you hear that there are people who are 40 years old and have no underlying health conditions and are not frontline health and social care workers who've managed to sharpen their elbows and get the jab, because that's simply taking it away from people who will benefit more from it. But it is messy. It's a very, very complex rollout. It's been the biggest logistical exercise in the country since the Second World War. And there are bound to be some bumps on the road, I'm afraid to say. Julie Krellin, the JCVI states that unpaid carers will get a vaccine because if they follow the welfare of the person they care for may be at risk. Why are you now only offering a vaccine if the person they look after is vulnerable to COVID? Surely, if an unpaid carer falls ill, the welfare of the person they look after will be at risk, regardless of their vulnerability to COVID. Good question. The JVCI particularly has focused on the welfare of the carers of people who are clinically vulnerable. Now, I'm not aware that the unpaid carers, were due to get vaccines because if they fall ill, the welfare of the person they care for may be at risk. If that's the case, then we can look back into that. But the theory has always been about protecting the people who are actually at risk from COVID. Okay. Tizzy Hayton, why, and do you not think keeping schools shut till after Easter would be a better idea? Interesting one, Tizzy. The government has always been very clear that it wants to get kids back into school as quickly as possible. And I entirely understand why. Because it's really good for the welfare of children and young people to be in school. Now, you might think that it would be better to delay it till after Easter, but actually, what doing it now means is that you get a couple of weeks to see what's happening, and then you get a natural break of Easter in order to reflect on what's happened. And if you have a fortnight and things look as if they're going not as well as we might hope, then we could take additional action and perhaps not bring people back after Easter. But if you leave it till after Easter, it becomes a different proposition. So again, I understand the logic of having a kind of effectively short-term opening for a fortnight and then allowing a natural fire break, if you like, before coming back again. Okay, Ali McGuinness, why are those in Group 6 unable to book onto a mass vaccination site where there are no vaccines been sent to the primary care network? Ali, I think we've covered some of this. In the south of Cumbria, there are vaccination sites in Kendal and in Ulverston, none yet in the north, but they are coming. And increasingly, even before they come, once the vaccine starts to roll out, it's recognised that North Cumbria is doing a lot of this via its primary care networks, and primary care networks will be getting more vaccine to support Group 6 as well, because we are using primary care networks a lot in the north of Cumbria. Hazel Dobson, Do we know if there's research being undertaken on the efficacy of the vaccine for those with compromised immune systems? Hazel, I can't give you chapter and verse on that, I'm afraid, but we know that the vaccine is being researched repeatedly and in different groups, and I'm sure that there will be work being done on people with compromised immune systems. I'm not aware of any publications that are in the pipeline at the moment, but I'm sure that it will be being done. Joanne Hill, am I expecting a spike once schools or colleges go back? Well, I'm certainly hoping not to have a spike, Joanne. It wouldn't be surprising if there was a bit of a rise, or even just a leveling off and not seeing the sort of reductions that we've been seeing in the past. But I'm hopeful that with the testing that's going on, taking people out of the school setting when they're positive, and with the increase in mask wearing in schools as well, that we might be able to keep a lid on some of that. Judith Winder, why are doctors not getting vaccinations? Where are they going? Sorry. Why are doctors not getting vaccinations? I assume you mean why are they not getting the supplies of vaccines to do things? Well, Judith, the program of rolling out vaccination to GPs is nationally driven, and it's dependent entirely on the supply that's coming into the country. So there's been a reduction in supply that's been coming into the UK in the last few weeks, just because of the challenges in getting the manufacturing up and running. But we are fully expecting that in the next couple of weeks, we'll see pretty much a doubling of supply coming into primary care. Sally Warwick, for folk with severe allergies, are content of vaccines available to view before called? Not with the risks of really so just don't take approach isn't really very helpful. No, absolutely. So Sally, yes, the content of vaccines should be available. They should be available certainly online. If you have severe allergies, the advice is to talk to your doctor beforehand, or when you go, have the conversation with the people who are doing the vaccination, because they know all about it. They know what the content of the vaccines are, and they can talk to you about it. But yes, the content is generally speaking available online if you want to research it yourself before you go. Fiona Millen, is Cumbria Council going to treat NHS staff with a thank you regardless of the government, a day of thank you, or a community of gifts through businesses? Oh, Fiona, I'm not sure I can answer that. We obviously, NHS staff are owed significant thanks and significant praise for the work that they've been doing. And at the moment, everybody's just focused on rolling this out as best we can. There will be time for thanks to lots of people, not just the NHS, a little bit later on in the summer, I think. Suzanne Hodgson, any decisions been made about giving a first dose of one vaccine and then a second of a different one is effective? Interesting question, Suzanne. That is still being researched at the moment. There are early indications that it might actually be beneficial to mix the vaccines, but there's been no formal scientific studies done on that. And of course, so a lot of people are sticking to the studies that have been done, but that research is also being looked at the moment, because there's good theoretical evidence why it might be helpful. So it's being studied, and if it starts to look as if that's more effective, then the clinical protocol. James England, if testing is voluntary in secondary schools, how will they manage those that don't follow the testing advice? James, simply, it is voluntary. If people are not getting themselves tested, they will still be able to come into school, and they will just be treated as normal, as everybody else. There's no way in which we can enforce testing in school settings, and we're not going to be in a position to refuse people an education because they're unwilling to get tested. So somebody's saying, no one answers our questions. Well, I hope I'm answering your questions here. Ray Forrester, my wife is classed as high risk and is wondering if there will be any more centres to open up in Carlisle for the vaccines, as we're having to travel from the other side of Carlisle. She was given the option of Newcastle, Morecambe and Kendal originally. Yes, Ray, further vaccination centres are going to be opening up, including one in a pharmacy on Monday, and then there will be others over the course of the rest of this month. Ted Stamper, the testing of the vaccine in Brazil and South Africa, is it possible that due to this, antibiotics don't work as well as they used to due to antibiotic resistance? Is this the same for COVID vaccine? Right, interesting questions, Ted. No indication that the virus has mutated because of the testing in Brazil and South Africa. Testing, of course, has been done throughout the entire world, not just in Brazil and South Africa. The viruses mutate. That's what they do. But it's also certainly true that when you don't have a vaccine, virus mutations are pretty random, and what gets selected for is the viruses that spread more easily. And we saw that, for example, with the Kent vaccine. As you start to vaccinate people, you put a selection pressure on the virus to become more immune to the vaccine itself. So that's why it's important when you're doing this vaccination program to roll it out as quickly as possible and to minimize transmission while you're doing it, so you don't release the transmission, release the lockdown rules too quickly while the vaccination program is going on. Tommy Beattie, why can't Group 6 people book on any site even although they are now eligible? Tommy, Group 6 people are supposed to be being vaccinated through primary care networks. So that might be the rationale for that. You should be being called by your local primary care network. Catherine Wilson, will all secondary schools in Cumbria be doing twice weekly tests for its students? I believe they will. Catherine, certainly for the first 2 weeks where the tests are being done in schools, and then it moves to home testing. Some good praise there for people involved in the Kendall Vaccination Centre. Karen Alderson, why is Keswick and Solway PCN not receiving sufficient vaccine to give to those in cohort 5 and 6, yet North Carlisle Medical vaccinating cohort 9? Well, Karen, if North Carlisle Medical is genuinely vaccinating cohort 9, they absolutely should not be vaccinating cohort 9. If they've finished cohorts 5 and 6, then they ought to be rolling out to cohort 7. And we'll follow that up. But my suspicion is that North Carlisle Medical Centre is not systematically vaccinating cohort 9 at this point. There might be some people from cohort 9 who are slipping through the net a little bit and getting into it, but nobody is systematically vaccinating cohort 9 yet. Caroline Lalami, but do we think this virus is passed on in any form other than droplets? If everyone wearing masks and not coughing, how are people still getting infected? Could it be contracted through touching goods on shelves, etc.? So yes, Caroline, droplets are the main means of transmitting this virus. It's also potentially happening via aerosols, which are very, very small droplets, effectively, which are much more likely to get round and through the masks that people are wearing. And there is a theoretical possibility of it being contacted through touching things that have also been infected. But our understanding at the moment is that is much less of a route of transmission than we first feared it might be. It clearly can happen. It's one of the reasons why cleaning is so important and hand washing is so important. But it's much less important as a route of transmission than we thought it was earlier on in this pandemic. Alexander Sharp, are the vaccinations able to be mixed? And can you choose which vaccine you can have? So yes, it's possible to mix them. At the moment, the clinical advice is to stick to the two between the two jabs, but there is some evidence that it might be beneficial to mix them. And there's certainly no evidence to suggest that it's dangerous to mix them. And so there are times when you can mix them. Normally, you can't choose which vaccination you have. If you're invited, you'll get the vaccine that they've got at the time, and that could change week to week. Katrina Leather Nicholson, realised the vaccine hasn't given me COVID. Oh, sorry, Katrina, yes, a response to the earlier question. Worried the immune system response to the second vaccine is going to be significant and will delay the recovery. It shouldn't, Katrina, but do talk to your GP and talk to the people who are doing the vaccinations just to clarify their advice on that. You're not supposed to get the jab within 28 days of having COVID, for that very reason. But the jabs, of course, are being given 12 weeks apart now. So by then, I think that your immune response should be back to the sort of levels that you would have expected. Vicky Vernon suffer with diabetes and COPD and other health issues and are scared of having it. Scared of having the jab. I assume that means Vicky. Um, Vicky, please don't be scared of having the jab. If you've got diabetes and COPD, you're exactly the sort of person who really needs to have this jab. Please do go and get it as soon as you can. If you've got those conditions, you're in the clinically vulnerable group. You will be eligible for it right now, and I strongly advise you to go and get the jab. But if you're still worried, do talk to your GP or talk to the people who are doing the jabs, and they will be able to give you some further advice that's more tailored to your own situation. Fiona Mullen, North Cumbria Healthcare app is asking people to sign up for a vaccination card, probably for a passport. Someone signed up for today. North Healthcare seems to be doing vaccination through the A to Z. I'm not aware of that, Fiona. We don't think that there's certainly nothing nationally coming out about vaccination passports at the moment. If once you get your vaccine, you do get a card that says what vaccine you've had and gives you your appointment time for the next one. But that's not a vaccination passport at the moment. They shouldn't be working through A to Z, except potentially within each of the cohorts, where that might be the best way for them to do it. Jules Muck, when are over 30 is going to be vaccinated? Kids back at school next week and a single parent. Jules, over 30s are going to be a little bit off yet. It's likely that even once the first 9 cohorts have been done, that the next step will be to work down the age groups from 40 to 50 and then from 30 to 40. So it will take a little while yet, but the government's commitment is to get everybody vaccinated by July. And I would not be at all surprised if we were able to do that. So that may sound like a long time off, but it's really not going to be that long. When will Whitehaven get a hub, Margaret Kennedy? There will be a community pharmacy hub in Whitehaven with any luck from Monday. Neil Lorraine Johnson. How come my friend who is starting chemotherapy for bowel cancer has not had her first vaccine, but people that are not vulnerable have had theirs? Well, Neil Lorraine, the people who are starting chemotherapy quite often have substantially compromised immune systems. So it may well be that clinically the judgment has been that